they give you E negative or B positive. You recognize the square?
Yes.
Yeah. You recognize the RH? Yeah. Would you respond to naked blood? No. Okay, so they can give you anything, and you'd be okay.
Just because it has both on there, that doesn't, if you give only A or B, doesn't it still attack some?
No. Because
Because it has the others on there.
it's looking for what's foreign. Okay?
Oh.
So it's not going to make an antibody against this because it has that, and it's not going to make an antibody against this because it has that. Even though this blood is missing this, it doesn't care. It's just going to make antibodies against what it doesn't have. Okay? Yes?
So AB recipient, O donor.
AB positive, universal recipient, O negative, universal donor. If you're O negative, they will call you all the time. Get your blood. What if you're O positive? Can you give to O negative? No. No, that RH would still trigger an immune response. Questions?
Is it the same response regarding RH versus
It
the
is.
other type?
So there's the little summary chart. Okay. Here is our universal recipient. Here's our universal donor. If you're AB positive, they're not going to call you to donate very much because you can only donate to other AB positive people. All right. Now, RH factor turned out to be a big deal, not for blood typing as much as hemolytic newborn disease. That's when they actually figured out there was this other antigen called RH factor, and they looked into it more seriously. Like I said, this is an antigen that they found in rhesus monkeys, and they found that human blood can have it, or they might not have it as well. Okay, that's where you get the plus and the minus from. If you have RH antigen, you're positive. If you do not have it, you're negative. Okay? So let's look at hemolytic newborn disease. Oops, sorry, too fast. The problem comes when mom is negative and dad is positive. Okay, so dad is positive for RH, and mom is negative for RH. Okay, and they have a baby that's positive, RH positive. Okay, mom's immune system is working for mom and for baby. Okay, she's got to do double duty. So her immune system, does she recognize that RH antigen? No, her blood doesn't have it. So she sees RH as foreign. So what's she going to do? She's going to mount an immune response and destroy it. The problem is that's the baby's blood. So she's going to wind up destroying the baby's blood and eventually the baby. Okay. That's actually why you have to get your blood test when you're getting married. In some states, it's still on the books that you can't get married if you're plus or minus. Well, there's a lot of laws on the books, like you have to walk 10 feet in front of your car with a lantern, that they just never change. So it's still on the books, but they never change. Okay, but that's actually why you get your blood tested when you get married, to see if this is a problem.
So there's no way around that?
Yes, there's obviously lots of ways around that nowadays, but it's still listed there. That way they still ask for it, which, you know, they don't have to. Okay, so once again, the problem is with the second time. The first time that this happens, so the first baby actually was probably okay, because this usually happens as before there was a placenta and that wasn't crossing over. But during birth, that did cross over. And so mom's system now saw baby's blood, and mom learned to make antibodies. Okay, so first baby's okay. But second baby is a problem, because mom now knows how to make antibodies. That's why we have all these antibodies here. So now when she gets pregnant the second time, those antibodies will cross the placenta. IgG crosses the placenta and will destroy the blood in the baby.
So what happened to the second baby?
Say that again?
What happened to the second baby?
Why have the second baby?
No, what happened?
What happened?
What happens? It would destroy the second baby.
It's
Yeah.
died
Mhm.
for sure.
All right. So here's the picture from your book. Same thing though. First pregnancy, the baby's here. That blood does have antigens, and then during birth, we actually get that blood crossover into mom. She learns how to make antibodies against Rh, so that when she gets pregnant the second time with a positive baby and a negative mother, her antibodies would attack and destroy the baby. So what they do is they administer RhoGAM. So they give RhoGAM to moms that are Rh negative and are carrying Rh positive babies. So basically they block this, and the mother doesn't have that problem. You can carry the child.
Isn't that something that could be given like for a transfusion or blood transfusion? So,
Yeah.
yeah.
Definitely. What about positive mom and negative dad? Is that a problem?
Yeah. Yes.
Positive mom, negative dad.
No.
Okay. Baby could be negative.
Oh.
Is mom going to destroy it?
No.
No, because it's missing something. It's not that it has something foreign, it's that it's missing something. Okay, so that wouldn't be a problem. It's only when mom is negative and baby's positive. We can get this with some drugs. Some drugs will induce this state as well. So these cytotoxic reactions. Blood molecules can form these haptenes. So what do you remember about haptenes? Let me read that. This was with an allergic reaction. Haptenes are small antigenic molecules. Is your immune system set up to recognize super small? No, we're not. Okay, we're not set up to recognize super small, like protein size, single protein size small. We're not set up to recognize that. Okay, so we shouldn't recognize that. But the problem comes when these haptenes bind to drug molecules. When they bind to drug molecules, now this is an antigen on the outside of a larger thing. And that's what our immune system is set up to respond to. Okay, so we actually have quite a few drugs, unfortunately, that can produce these conditions. The haptene or the drug molecules can also bind to blood cells or platelets. So sometimes it's the drug itself that binds to our own cells, and then our body targets our own cells. So here's an example. Here's a platelet. Here's the drug. The drug's fairly small, but unfortunately the drug binds to this platelet. What does that look like now? Looks like a bacteria, right? Looks like a bacteria with a lot of antigen on the outside. So our immune system learns how to make antibodies against that particular antigen. And that calls in the complement system. What does the complement system do? Causes inflammation. Good, so the patient's obviously going to experience inflammation. detoxinization, these are gonna get eaten. What were those though? Platelets, you can do without platelets, right? No, not really. Okay, and then what else? Cytolysis, so destroy them. Okay? So your blood cells, your platelets are being destroyed because of this hypersensitivity. That was type 2. Questions on type 2? It's an antibody that's mediating that. It's usually IgG or IgM. The cell, whatever it is killed. In type 3 hypersensitivities, we see immune complex mediated hypersensitivities. These are more complicated interactions, and I'll show you some pictures. They can be systemic or localized. So in localized things, we're seeing like pneumonia type symptoms or other problems. Systemic, we're seeing things like rheumatoid arthritis and lupus. Okay, so these are bigger problems. Here's an example of what's happening. Okay, so once again, we have IgG and it's binding to antigen. And here we actually have a sandwich of IgG, antigen, IgG. And it makes these sandwiches. And normally that would be good, right? Why? This was really a bacteria or a virus. It just neutralized it, right? Exactly right. It's contained. It's been neutralized. But this isn't. And notice what happened right here. This is the biggest problem. What happened right there?
This human cell.
It embedded itself in a tissue membrane. So this complex is now stuck in a tissue membrane. It's not going anywhere. Okay? So if this is stuck in your basement membrane, your immune system is going to come and try and help this out, right? I see antibodies, I'm going to respond, I'm going to help with this infection. Neutrophils are going to release chemicals to kill the antigen, but the antigen is coated in IgG. So very few of those molecules get to the antigen to destroy it. Where do all those molecules go?
To the cell
They go
membrane.
to your tissue layer and start destroying it. So because that is an embedded complex, you got all these immune cells dumping all these enzymes to try and destroy the antigen, but what they wind up doing is destroying that tissue layer. So in lupus, it depends where this is happening, where you see the symptomology. In rheumatoid arthritis, where would you see this? In joints, right? In joints, you see this damage, this inflammation, this destruction of tissue. All right, and here's another picture from, I think this one's from your book. Same thing. Usually what happens is these complexes happen in the bloodstream. And that's fine, because then they can be cleaned up. Okay, macrophage or something can ingest and destroy these and it's all cleaned up. The problem is when they embed themselves into the membrane. So now it's embedded in the membrane. When the rest of the immune system comes, such as phagocytes or complement or neutrophils, they're going to actually try and destroy this antigen. And they have enzymes that they use to destroy it. Now those enzymes are all being released, and what's being destroyed is your tissue. So this is more long-term, because this is stuck here. So this is happening over and over again. So this is more long-term destruction of those tissues. They can, but in the meantime, I mean, it's harder. It's not like it's free-floating like it was before. It's actually attached here. And unfortunately, usually what happens is so much, can I go back to this picture because it's a little bit easier to show? So much tissue is destroyed, it gets destroyed all the way back to here, that now these can float away. But the reason that these become loose is because all of this was damaged so heavily. Okay? And then the problem exists again, that once this builds back up, this can reoccur and this damage can occur again. So sometimes for these patients, they have episodes where they're very, very symptomatic, but then they get better for a while, and then they become symptomatic. And that's part of this process. Here is when they're symptomatic. Then they recover, and while this is going on, they don't have symptoms. But when this occurs again, then they become symptomatic. All right. So here, we're talking about a situation which is like pneumonia. It's you're breathing that antigen into your lungs. And it's becoming that antigen-antibody complex is becoming embedded in your lung tissue. So think about what that's going to be like if the tissue in your lungs is destroyed. Okay? So it's inhaling that same antigen over and over again that's going to cause that destruction. Glomerular nephritis, we're seeing the damage in the kidneys, right? Okay, this is pretty common when we get those complexes. Everything's filtered through the kidneys, right? So of course it's going to filter this big complex through the kidneys. The problem is if that complex, that antigen-antibody complex, gets lodged into the tissue in the kidneys, now we have the immune cells destroying the kidneys. Okay? And this can result in kidney failure and death. What we see first is blood filtration starts to be impeded, right? So we're going to start seeing toxicity in the blood first, and then later on kidney failure. Hopefully they can do something at this stage, before it gets to this stage. Questions? Type 2 or type 3? Our last hypersensitivity is type 4. Type 4 hypersensitivities are called delayed or cell-mediated hypersensitivities. We're talking about cell-mediated hypersensitivities. What are we talking about? T cells, good. And that's why it's delayed. Because remember, a T cell has to physically travel to the site of infection. So these are always slow. Okay? Inflammation can occur 12 is pretty fast, 24 hours later. This is not like a reaction to cat dander where it happens within minutes. It happens later, a day later. So what we're seeing is antigen and antigen-presenting cells, but T cells. And T cells are causing the damage. It's a delayed response because we actually have to get the T cells to that area, to the site where the antigen is. There's a pretty common type 4 reaction, cell-mediated reaction. Okay, so these, remember we had the different T cells? We talked a lot about the killer T cells, or the cytotoxic T cells, and the helper T cells. These are actually the delayed hypersensitivity T cells. Okay, these were those ones that were found in response to organ rejection. They're doing the same thing here in hypersensitivity. Okay, so cytokines attract macrophages to the initial tissue damage. So originally something's happened and damaged the tissue. But this is not what your hand looks like when it first happened. What you're looking at here is a latex reaction. This person is having a response to latex gloves. Okay, another pretty common one would be what? You would think of something?
Peanuts.
Huh?
Peanuts?
Oh, no.
Peanuts, yeah. Peanuts.
Poison oak? Poison ivy? So, one here. Okay. So what happened originally was, let's say it's poison oak. They touched the poison oak, and that oil was deposited on their skin. Okay, but you don't notice anything. Your hands look like normal, which is a bad thing because then you can touch other places and spread it all over the place. But about 24 hours later, your hands look like that picture, okay? Because the T cells have had a chance to migrate to that area. Okay. So let's look at some other examples. The tuberculin response, okay? Really common for people to, especially if you're working in healthcare or education, to ask for people that ask you to get a TB test, right? Okay, so for those of you that have gotten a TB test, what happens? You go there, everybody's doing this. Okay, they stick some liquid right under your skin, right? It doesn't go into your bloodstream, it goes right under your skin, and then what happens? You have to go back in about 2 days, right? And what are they looking for? Bump, redness, swelling. Okay, good. So what they're looking for is this type 4 hypersensitivity. They're looking to see if what they're sticking under your skin is tuberculosis antigen. And if you've come in contact with tuberculosis before, if you've been exposed or infected, would you have made T cells against it? Yeah, so in 72 hours, those T cells would have gone to that site and caused a response. And that's what they're looking for. Okay, so they're actually putting antigens to tuberculosis, Mycobacterium tuberculosis under there. No response in the skin if you were never infected or vaccinated. We'll have to talk about that more later. But you get a red, hard swelling that develops if the tuberculin injected, if you've been infected or exposed before. Do I have a picture? No, of course I don't have a picture. Okay, so basically what happens if you have had tuberculosis before, you have memory cells, right? So those memory T cells activate and they go to the site of the infection. But it takes them a while to travel there. Usually it takes 24 hours, but they ask for you to come back in 2 days so they can definitely see a response. Allergic contact dermatitis. What does that sound like? Skin. This is a skin reaction. You're touching something and you're having this hypersensitivity. What are common things? Latex for sure. Perfume and cosmetics, definitely. Grass for some people, yes. Formaldehyde is another big one. Okay, formaldehyde. Those actually, same things happening. We're getting that cytokine, we're getting T cells traveling to the site of contact and causing destruction in that area. You always get this fluid-filled response because of all the cytokines that are being released in the vasodilation in that area, but then you get the cell destruction by the T cells. For allergic contact dermatitis, the most common remedy is corticosteroids. So what are they doing with those? Suppressing your immune response. Okay, they're shutting off your immune response. All right, so there are our 4 different hypersensitivities. Okay, type 1 is immediate. We see IgE involved, plus the mast cells or the basophils, which are over here. And this is usually fast, seconds to minutes. Okay, type 2 is cytotoxic. So cells are being destroyed. We see antibodies involved, usually IgG and IgM. And this takes minutes to hours. Type 3, that was that immune complex that's embedded in your tissue, and your immune system is destroying tissue layers. This takes several hours. And for the type 4, the delayed hypersensitivities, these are T cells, and this takes several days. And those are our 4 types of hypersensitivity. Question? things to use to treat them, no. Like the corticosteroids, no. I would ask you more like